Good morning from Atlanta. I wish I could have been with you in person, but unfortunately my schedule did not allow that. But I'm very pleased and happy that Mr. Ash Mosahebi, consultant plastic surgeon at the Royal Free Hospital in London and an editorial board member of Aesthetic Surgery Journal, is there in person, not only to represent ASJ, but also our specialty. By way of disclosures, I have no conflict of interest as I'm not involved with industry. I will start by thanking and congratulating the organizers for bringing together thought leaders from various aesthetic specialties with media and industry representatives. The stated goal of this inaugural Aesthetic Alliance Summit is to foster responsible media reporting in aesthetics and the establishment of a database of appropriately qualified experts. These are lofty goals serving the best interest of the public, our patients. I hasten to add that I personally believe that most, but not all, media reporting and industry advertising is in fact responsible. The public, our potential patients, gather information from print and electronic news media, social media, physician and industry advertising, and their websites. A lot of the information, especially on physician websites, is self-serving, not supported by evidence, and some is even misleading or false. The social media are replete with catchy names given to surgical procedures and cosmetic treatments, and everyone is a self-appointed expert. The public is not able to differentiate between hype and truth, and it is certainly difficult for the layperson to distinguish who is truly an expert and who is self-appointed. In general, they believe, or at least they want to believe, everything they read or hear, especially promises of excellent results, no risk, no scars, no downtime, and dare I say, little if any cost. So what's our role? Your role as media, as industry, and our role as physicians. My role as editor of Aesthetic Surgery Journal. The role of professional organizations. Do we have a responsibility to provide accurate, evidence-based information which is not self-serving? Of course we do. I strongly feel we all have a moral obligation to provide accurate information and to expose myths and misleading, self-serving information. The responsibility of Aesthetic Surgery Journal is to publish peer-reviewed scientific papers. Peer review means that the validity as well as the veracity of the material has been vetted by experts, and I mean real recognized experts in the field. The level of evidence published alongside each article adds further credence to the work. On a regular basis, ASJ releases to the press information on published work which would be of educational value to the public at large. In addition to our efforts as a journal, the American Society for Aesthetic Plastic Surgery has a media team, a press office, and public education materials aimed at disseminating accurate information readily understood by the public. Both the journal and ASAPS are active in social media, promoting evidence-based material, and ASAPS has a public section on our website full of accurate, useful information covering all aesthetic surgical procedures and cosmetic treatments. There's no question that most national societies also provide similar public services. But the efforts of our journal, our societies, pales when compared to the reach, the influence, and dare I say, the power of the press and the social media. With that power, with that reach, also comes along responsibility to provide accurate information. Most experts in the media have access to this information through our societies and through their own expert contacts. One of the purposes of this gathering is to add to the list of these qualified experts so that we can serve the media and the public. Our organization, ASAPS, on an annual basis presents awards to print, TV, and electronic media reporters who have accurately and responsibly covered topics of aesthetic interest. Direct-to-consumer advertising by industry is a fact of life. It's here to stay. It provides useful information to the public, and in the aesthetic arena, it encourages the public to seek treatments. It brings patients into our offices. Most industry advertising and promotions are responsible, accurate, and presented with integrity, which encourages the public to seek cosmetic treatment. Industry representatives invited to participate today all have these high standards. Regrettably, I cannot say that for all of industry. I would urge all to only present verified, evidence-based material to the public to avoid excessive and unrealistic claims. I would again commend the organizers for bringing you all together today to come to a consensus on this most important topic. Meeting patient expectations with favorable outcomes and safety is all our goal. False, misleading, self-serving information does nothing but raise expectations which cannot be met, cannot be fulfilled, leading to poor outcomes, disappointed patients. Poor outcomes and disappointment reflect poorly on all of us as physicians, as industry. I wish you all a very productive day and hope to join you next time.